President, let me first of all join with my good friend Senator Cardin in appreciating the incredible work that really so many federal employees have done to make these programs work. I was with the SBA Director, I think about 2 weeks ago on Friday. She said in the first 14 days of the PPP program, they did 14 months of loans in that 14-day period. And I've thought many times Secretary Mnuchin set these high standards for how quickly we would get to each of these points, and probably only later realize just how difficult it is to get the federal government to move. But this is a case where the federal government has moved, the Congress has moved, working together. We didn't have the element of time on our side. We really had to move quickly. And I think we all knew when we were doing that that we were going to have some miscalculations, whether it was the amount of money for PPP or a program that wasn't quite as refined as it needed to be. And hopefully we're right now trying to look at not only how we have filled in the blanks on the programs that we so quickly dealt with in March, but also to look forward at May and July and try to figure out what the economy is going to need, where we're going to be in this healthcare crisis in May and July. Certainly a number of our states are beginning to reopen. States like Missouri are opening in what I think is exactly the appropriate way. The governors looked at the whole state and said, we're going to step back from our initial order in the entire state. We're going to remove that order, but he's then worked thoughtfully and carefully with the mayor of St. Louis and the mayor of Kansas City and the county executives in bigger counties, the mayors of Columbia and Springfield, and not gotten fights with local officials about situations that they have every reason to know more about than he does, just like the governor of Missouri has every reason to know more than somebody in Washington, D.C. about when our state should reopen. I'm glad the president has let governors have that sort of authority, and I think in most states, including mine, governors have stepped back and let local officials assert their view of what should happen in the area where they've been elected to be responsible. And with that combination of things, we're going to reopen and begin to see the economy reconnect again, like it has not connected for the last couple of months. At the same time, we've got these two fights. One is to save the economy, and one is this important fight against the virus. I think in the 2 months since we went home after the CARES Act, I've spent most of my time working on the healthcare side of this. Senator Alexander's the authorizing chairman for these healthcare programs. I'm the appropriating chairman for most of them, programs that certainly in the last months Americans have learned a lot more about than they ever knew about before. Who knew that the Center for Disease Control, the CDC, was doing what it was doing, or that Health and Human Services had the responsibility that they had, or how troublesome it was if we let our hospitals get out of whack in terms of income and continuing expenses. All of those things happen. One of the things I've worked on hard has been to get that research funding at the National Institute of Health, where Dr. Fauci runs only one of the double handful of agencies at NIH, the infectious disease part of that. But the American people begin to see those things that the government does, and also see that the government, like every other family or every other institution, doesn't respond to crisis with immediate efficiency, but does begin to work its way toward a solution. So we've spent a lot of time together with Senator Alexander and I have, with FDA and with all of those other agencies. And what we see happening, what I see happening, is a real willingness, with the total backing of the Congress, a real willingness to get out there and try to move these solutions at a faster rate than we ever have before. Dr. Fauci said early on that if we developed a vaccine in 18 months, that would be the world record for a U.S.-developed vaccine from a new virus to having a vaccine available. We're trying to do everything we can not only to meet that potential world record, but to beat that world record. And how are we doing that? We're doing that with things like the Shark Tank concept at NIH that we specifically put $1 billion behind in the last bill. $1 billion for a place where people would bring ideas for vaccine, for therapy, for testing, and you'd have that Shark Tank environment begin to evaluate which of those ideas deserve the help of the federal government to push them forward faster. And how would we do that? How would we push them forward faster? Obviously vaccine is what we need to fully emerge, in my view, from this. Therapies to deal with people who get the virus before we have the vaccine, and testing to know whether you've had it or not and hopefully have some level of immunity, or testing to know whether you've got it. And we've got to do better on all of those fronts. On testing, we need tests that are easier to take and get a quick response. We need millions of these tests that millions of Americans will take more than once. If you're at a factory, if you're in a close situation, if you're on a college campus, the administrator, the boss, you may they decide, I want to take that test every week. And I want to call my mother every week from this college campus and told her, I've taken the test again, just like I told you I would. I was okay last week. I'm still feeling okay. Nobody in my dorm is sick. It's okay that I'm here. And that's the kind of thing that will get us started. Well, how do we get to that quick, easy response test? How do we get to that therapy, and how would the Shark Tank work? People bring in ideas. Let's assume that on testing, that the Shark Tank decides there are really 10 of these that have real potential to work, and we're going to begin to advance them. And then at some point, there are 4 of them that are still 1 or 2 steps away from being fully vetted, but you don't want to wait till they're fully vetted to go into production. And so that's where another $1 billion at an agency called BARDA is, to take that $1 billion and find a private partner and say, we're going to go ahead and produce all 4 of these tests. We're going to have all 4 of these tests ready 30 days from now when we know which one works, because 30 days really matters. 30 days in getting back to school, 30 days in generating the economy. If you're 30 days ahead of where you would have been otherwise, you can put a lot of money behind that and still pay only a fraction of what we've been putting behind trying to stabilize the economy. And if 2 of them work in that 30-day period of time when you're going ahead and manufacturing all 4 of them, they're just ready quicker than they would have been otherwise. And if the 2 don't work, Madam President, we hear often the idea of failure is not an option. This is a case where actually failure is almost a certainty on some of the things you're trying. If you're not failing, you're not trying enough things. If all you did was advance 4 things that were going to work anyway, you really didn't take much of a chance to fast forward or dual track what you're trying to do. And so we're working hard to get ready to have those tests, a test where you have a normal blood draw to check your cholesterol. You could say when you turn that to your doctor, also check for COVID-19 if they don't ask you if you want to check for COVID-19. And then they could say you have it, and hopefully by the time that test is available, they could say you have it and you have enough of the antibodies, you have enough of what it took to fight this off, that you should have immunity up until the time we're likely to have a vaccine. That many Americans then know they're out there with no danger to themselves or no danger to others. That many Americans know that in all likelihood they can safely visit somebody they haven't been visiting for a while because they didn't want to take a chance of carrying a virus that now they know they can't possibly get. And so those kinds of things will make a real difference in our economy. Therapeutics. That we don't have the vaccine yet, you get the disease. We need to find and fast forward the manufacturer of the therapeutics we think are most likely to work, and the same with vaccines. And on all those fronts, we're making headway. I think we're probably testing, sophisticated testing, for the antibodies and for just a diagnostic test. We're having lots of interest in that, lots of private sector interest in an antibody test, this sclerosing test, where you know, particularly if scientists begin to say, if you've had it and you have this level of antibodies, you can't get it again, who wouldn't want to take that test? And we believe, the authorizing chairman, the appropriating committee, Senator Shelby, Senator Alexander, Senator Murray, and I all believe that the government should pay for that test, and we've said the government should pay for that test if your insurance company won't. Most insurance companies have said they'd pay for that test. Seems like to me if you've got millions of customers and a guaranteed payer, this is one that the private sector is quickly about to take care of on their own, and thank goodness for that. This is one of those times when the most sophisticated pharmaceutical, medical science, laboratory system in the world begins to pay off. And that's what we're going to see here. We've got other areas where companies are working together like they haven't before, where I know they've told our friends at the National Institute of Health, if we can test their experiment better at our facility than they can, bring it over here and test it over here. We need an all-out effort to get this economy going again. We need an all-out effort to get people's health secure. And once that's happened, I think we'll see all of those things come together. And so, Madam President, I think we've made great strides. I haven't heard anybody say in some time on this issue that Congress just hasn't provided enough resources to do this job. On the testing, therapeutics, medical device side of this, personal protective equipment side of this, people look at what the Congress has stepped up and done and said, okay, the Congress has given us the tools. Now the administration, the research scientists of America, American pharmaceutical companies, medical companies have to step in. I believe they are stepping in. Let's break some records here. Let's do some things quicker with the same amount of safety that we've done in the past. There is a dynamic need to do this. The American people understand why it needs to be done. People all over the world would benefit from our leadership here. I think we're seeing it. Hopefully we can continue on these efforts to have the bipartisan determination to win these two fights, the fight against the virus and the fight for the economy that the American people deserve.